Hi, I'm Dr. Tran. Thanks for joining me today to talk about the differences between dentures, snap-ins, and all-on-4. Here at Nuvia, we take time to educate our patients and help them make an informed decision. I'm going to talk about each device, and I'll let you in on a little secret, something that other providers don't want to share. This is a denture. It's made out of acrylic, which is a plastic. It's actually the same type of acrylic used to make acrylic nails. So it's not very strong. You can see it covers the palate. A device that covers the palate will affect taste. It will affect smell. A lot of taste, what we think is taste, is actually smell. So it's going to block all the receptors in your palate, and it sits on the soft tissue. So that means when you bite, you're putting all of the force on your gums. Studies show that with a denture, you have only 1/6 of the bite force of when you had teeth. 1/6 is about 16%, so you have a very significant decrease in bite force. With a complete set of dentures, you can see it's one set kind of floating on the gums, and so you can't actually bite with the front. If you bite on the front, it'll cause the back to dislodge. And a lot of patients, when they undergo a smile transformation, they dream about eating steak. Who wouldn't, right? But with a denture, you really can't. You can't chew in the front. You can't bite into an apple or bite into a sandwich. So there are certain limitations to a denture. For all the prosthetics, I make the comparison of a different mode of transportation. So I would say a denture is like a bicycle in comparison to a car or a plane. It'll get you there, but it's pretty basic and it requires a little more work from you. Our next device is a Snapin denture. A Snapin denture is kind of middle of the road in terms of cost and function. You'll have implants. They're usually placed in the front, and there are reciprocal snaps, so it clicks in like buttons on your shirt. These are supported with a combination of the implants and the soft tissue, so you're still getting tissue contact in the back, and there's usually a little bit of rotation. You still have your palatal coverage in most instances, although it can be thinned out a little bit. The inside of the denture will have clips, colored clips, or kind of like O-rings that engage the implants, and these wear down with time. Most patients need some sort of maintenance every 3 to 6 months for the clips, and that is an added cost that you need to consider when pursuing snap-in dentures. The next type of prosthesis is fixed in your mouth. It's screwed into the implants, and you cannot remove it at home. Only a dentist can remove it. There's different materials available. This is an acrylic-based one. The denture teeth are made with reinforced acrylic. And this is a fine material. It's been used for a long time. One of the strongest options available presently is zirconia. It's made out of basically a white metal ceramic, so it's very strong. We have the opportunity to customize the shape and customize the color of the teeth as well as the color of the gums. I prefer this one because it's the most aesthetic, so you'll get the most lifelike results. In comparison to other materials, this one does not wear, and so there's less maintenance required. Normally, to get a prosthetic device like this, it can take up to a year and a half, starting with extractions, healing, implant placement, implant healing, and then the final prosthetic process. We care about the patient experience, and we only want our patients to have the best. So that's why we don't provide any type of removable prosthesis like a denture or a snap-in. But here at Nuvia, we give you your permanent teeth in 24 hours. Other providers will promise new teeth, but the reality is you will have a plastic denture for a long time. At Nuvia, we have a proprietary process in which we can deliver a final prosthesis, a final device, 24 hours after surgery, which is incredible. It's really pushing the boundaries within dentistry while still following the scientific boundaries and guidelines. For a patient, it's so much better in terms of value, economic value, product, and service. So to me, it's a no-brainer. Take our 60-second quiz to find out if you are eligible for permanent teeth in 24 hours, right here. Click over here to see more smile makeovers.